Hi, and welcome back to Everything Hormones. I'm Dr. Ramsey, and today I have a very special guest with me. She works with us. She's been with us for a while in different roles. And since she's been with us, she's actually had 2 children. She's a wonderful practitioner. Our patients absolutely love Angela. They say that Dr. Colpaert reminds them of seeing me. So I want Dr. Colpaert, Angela, to share her story with you as she transitioned from conventional medicine to functional medicine.
Hello, everybody. My name is Angela Colpaert. I am a family nurse practitioner, and I received my doctorate. I owe so much of my journey to Dr. Ramsey, and it's an honor to be even compared to her. My journey is interesting. So I have been a nurse, an RN, for about 10 years. I graduated nursing school in 2016. So I went on to be a nurse, and even prior to that, I thought maybe I wanted to be an MD, and I switched in college to become a nurse because being an MD didn't resonate perfectly with me, which was a blessing in disguise because, of course, it's brought me to where I am today. So I worked in the hospital for 4 to 5 years. I worked in a combination of med-surg, oncology. I worked with adults. I worked with children. I did some home health, a lot of different areas. And then I decided I wanted to go back to school. I wanted to learn more. I wanted to do more. So I went back and got my family nurse practitioner. That was a journey in and of itself. I was going to school while getting married, while having a baby, while COVID was happening. So that definitely put a wrench in things. At times we persevered, but I started working here as a nurse in the lab around 2020. So right after COVID, at that time I had been working in the hospital. And as we all know, COVID changed a lot of things in healthcare and in the world, and my personal perspective on a lot of things, and really opened my eyes to a lot of things in medicine, in my personal life. And I got a call that there was a job opening here. I came and I worked in the lab, which was a blessing. I learned so much. I really knew very little about functional medicine, truthfully. I was trained, you get sick, you take antibiotics, you take a steroid, and that's that, right? Well, I worked in the lab and I learned very quickly there's much more to medicine than that. It was so beautiful because I learned through IV therapy and vitamins, not the only way to treat an illness is to suppress it, right? We can strengthen the immune system, like things we do with our vitamin C IVs. And that was a huge learning curve as a nurse here. But it was truly a blessing learning from the other nurses, honestly, from my patients, because oftentimes they knew a lot more than I did. And then, of course, Dr. Ramsey. And at that time, I was still going to school, which was interesting because you're learning 2 different philosophies at one time. And then I actually became Dr. Ramsey's assistant, which was another very pivotal moment for me because before that, I knew very little about hormone replacement, which, of course, we know is Dr. Ramsey's specialty. And I really didn't know the importance of hormones. We didn't learn much about that in conventional schooling, really at all, actually, especially in a nurse practitioner program.
Not in my school either, Naturopathic College.
Yeah, and it's a common thing you hear. You don't get the hormone training, which is just, as we know, a huge disservice to everybody. So I got to sit in a lot of her visits for about a year. I worked as a scribe, doing behind the scenes things for her. But I just got to be a sponge and learn everything. And soon enough, someone would say, "Oh, I really don't sleep well," and I'd be like, "Oh, she's gonna give her progesterone." I was testing myself.
That's awesome.
I started to know, and sometimes Ramsey would be like, "What do you think she needs?" I was like, "Progesterone." We love our progesterone, right?
Yes.
And then I finally graduated nurse practitioner school after what seemed like a whirlwind of life. And that was back in 2023. And at that point, I had been at Revitalize for quite a while. I had a 6-month-old. And then that was the start of a new era. I kind of transitioned into a provider role with Dr. Ramsey. She was so gracious to continue to be my mentor, and her patients were gracious as well to let me give a shot at caring for them in the way that Dr. Ramsey has for so long, for so many patients. And that's been the last 2.5 years, 3 years, which has been a beautiful ride. I have, through that time, gotten the opportunity to study with Dr. Ramsey's teacher, Neil Rosier, as well. I've completed, there's 4 different trainings that you can go to for the hormone training, and it is quite a ride in and of itself. And then practicing alongside Dr. Ramsey this whole time. And then here we are. I'm learning every single day, but it has been quite a transition. Having that background of conventional medicine, I think it does serve me well to understand, where our patients are coming from and why providers may do what they do, even though we don't typically agree with it.
Right. But you care about really helping people, and that's what this is all about.
Yes.
Like you said, it's not about suppressing something, cutting something out. It's really about understanding our patients and what they need to be their best self. That's why they come.
Yes. Yeah. Something Dr. Ramsey says constantly with patients that I have now stole from her is that hormones are our batteries. And I don't think you can explain it in any other way. That really hit home to me. And it's truly the best way we can care for people. You're replacing their batteries, right?
That they
Quite
can't
literally.
make. It's almost like, would you push your car around if your battery dies?
Exactly.
We push our bodies around, but we don't have to.
I commonly talk about thyroid as the engine of a car because people understand that, without the engine, things are not moving. And it's just a really beautiful way to practice medicine. And truthfully, in my opinion, it's not even a specialty. It is medicine. I mean, hormones are everything.
Right.
Everything else is just extra.
Right.
It really, once you get into the weeds of it, it just truly is, the best way to help your patients.
Yeah, because you see immediate changes, which is so much fun. But I have a few questions for you.
Absolutely.
I believe, correct me if I'm wrong, when you joined us as a nurse, you joined us because you didn't want the vaccine? Am I correct?
That was a big part of it, yeah. I worked in the hospital setting, and while it was not necessarily required, it was being pushed, and that was something I experienced a lot through nurse practitioner school, and I no longer felt aligned with that. And of course, I was welcomed with open arms here.
I thought it was required in the hospital.
In my school program, they were really trying to push it. I wasn't allowed to do clinicals at certain places because I hadn't been vaccinated. In my job setting at the time in the hospital, it was not yet required. So I got out of there before it was. But yes, during nurse practitioner school, I had to fight tooth and nail not to.
Right. You did a good job getting around that.
It was very difficult, but I am happy to this day.
My next question is, what did you think Dr. Rosier the first time you met him?
So Dr. Ramsey had warned me, of course, that, hey, he's got an interesting approach to teaching. So I was definitely taken aback. And, like they spoke on their prior podcast, he really makes you think. It's not laid out for you. Do this, do this, do this, do this.
There's no hand holding.
Absolutely not. You're really dissecting the literature, and it's challenging you to, okay, hey, this is why they're saying what they're saying, but let's think about that farther. X doesn't always equal Y, Z, right? So it was very challenging at first, and I left being like, I'm so confused, right? Thankfully, I had some foundation from you, and I think, well, Dr. Rosier maybe didn't hold my hand. Dr. Ramsey did a little bit. So thank God for that. I thought it was wonderful, and I will continue to seek out training from him and hormone training because it's what's changed my career and my life. Truly.
Right. And he does his teaching because he cares as well. You don't see many MDs who care as much about people that he took a liking to the literature when he saw what hormones actually do to the ER nurses that he worked with. That's how he started out.
Right.
So, without him personally, I don't think I'd be doing this.
I don't think many of us would.
Right.
Because there's really no other training out there like his.
Right.
And it's beautiful to see more and more providers adopting this type of medicine and hormones because, like you've said, 30 years, I think now.
Well, with him, I graduated 30 years ago.
Okay.
And I started studying with him when I was nursing my first child. So that was 26 years ago, 27 years ago. So A long time, almost.
Well, and back then you were one of the only
Right.
doing it.
Right. And many doctors thought what I did was risky. They still do.
Of course. Yeah.
But it's getting better and better.
Absolutely.
We treat doctors, we treat nurse practitioners. So it's getting better. And like the FDA is changing its stance towards what we do, which is huge because
huge.
more and more patients now are saying, oh, it is safe.
Mm-hmm.
Instead of just hearing it from us, the FDA said it. Okay, now it's safe.
Yeah, it's definitely opening the door for a lot of people. And while, we never have leaned into the fear base, it's important. Like I say to my patients, I could tell you all day that it's safe, but I need you to believe that it's safe. And if that means lifting that from the FDA and the other noise that you hear bring you comfort, that's huge for me. And I think that's powerful for our patients. They, when they first meet us, they don't know us.
Right.
So it takes time to really know that we're doing what the literature says.
And the literature skewed what people believe because of synthetic hormones and their outcomes compared to looking at studies on bioidentical hormones. There is no comparison.
Absolutely.
And you seem to have become more comfortable with treating women after breast cancer with estrogen, et cetera.
Yeah, it's definitely been a mind shift, right? It's in the hormone training, they talk a lot about bias. And I'm saying that wrong. Confirmation bias, yes. And that really hit home for me in the very first hormone training because I still to this day find myself having to kind of turn that off because you have that conventional training that just tells you this is bad, that is bad, this person cannot have this. And as you mentioned, cancer or breast cancer, it's always been lumped with estrogen. And I've seen many women who you've seen for many years who are thriving post breast cancer on hormone replacement.
Right.
I have started to tell women, I can never guarantee that you're not going to get breast cancer or that you're not going to get it again. But I can guarantee that not doing hormones is not going to guarantee it either.
It's going to increase your risk even more.
Exactly.
Not taking hormones.
And at the end of the day, quality of life is what is the most important.
Right.
I like something Neil has said too is, I forget the statistic today, but he says a woman is more likely to die from a broken hip or heart disease.
Which is preventable with
estrogen. Than they are breast cancer, right?
Right.
And that's, women, as we know, when you lose your estrogen, your bones become more brittle, osteoporosis. We all know we get older and there may be falls. Breaking a hip is...
Could be deadly.
It can be deadly.
Right. And what Angela meant, like confirmational bias means like what you learn first is Bible. Like you learn that hormones are risky because of the synthetic hormone studies. And that's so hard to break in most doctors who've been in practice. This is what they believe. So when they hear we're doing this all day long, they think what we're doing is risky. But more and more, doctors are starting to understand, okay, maybe it's not so risky. And actually, maybe it's beneficial. So we feel privileged to have the honor to serve so many people with giving them back what they can't make anymore. We're not giving them something synthetic. And when you give back what the body can't make, the body starts functioning better. We reduce aging risk significantly. And we have a lot of happy patients. It's just a fun job for us.
It really is. And it's really... people think of hormones as, well, let me just help my hot flashes or my libido.
Symptoms.
But it's really the women, unfortunately, that have a really easy time going through perimenopause and menopause, maybe don't feel much, that are the most disservice because most women are not offered hormones unless you're in here.
Right.
Unless you have those symptoms. I mean, you could feel perfectly at age 55, 60, and I'm still going to say you should replace your hormones because that's going to be the best way to age gracefully and age optimally. You may feel good today, but let's feel good for the rest of our life.
Right. Yeah, women who come for the treatment of hot flashes, they say, after we've seen them a few times, is how many other benefits they got that they didn't realize were treatable with hormones.
It's kind of like when I say when I treat men versus women are very different. Women are very in tune with their body, right? They can tell you this doesn't feel right, this doesn't. Men are like, I feel good. Like, I don't know. Everything's fine. I'm like, okay, well, how is your energy? Well, it could be better. Well, how's your sleep? Well, so it starts to come out. And I think the point I'm making is you don't always know how good you could feel.
That's true.
Women too, but especially men.
Right. And that brings me to this question. I know you've become comfortable treating post-breast cancer women. What about men with prostate cancer or who had a history of prostate cancer?
Yeah, I think that one's even easier because there's lots of literature to support that testosterone does not cause prostate cancer, nor does it cause a recurrence of it. And I find a lot of comfort in, our labs that we do for men. Conventionally, they'll only check a PSA, as you know.
Right. Which doesn't tell us much.
No. And you can check a PSA % free, which, as you know, has helped us actually catch early prostate cancer when your PSA is normal and in reverse. So we have wonderful screening tools and knowing the literature that, testosterone does not equal prostate cancer. In fact, it helps to prevent it, helps to keep the prostate healthy.
Yeah, low testosterone levels are a risk for prostate cancer.
Absolutely.
And men who have prostate cancer, even in our practice, don't get worse by taking testosterone. So it's just such a joy.
Or estrogen, right?
Well, estrogen was the first treatment to treat prostate cancer. It did it very well, ablated the tumors. However, the type of estrogen they used was called DES, which had a lot of side effects. So that went out the door. Now these hot, expensive LHRH agonist drugs are being used, very expensive. And not only are they expensive, but they induce a very poor quality of life in men. So it's fun dispelling the myths.
Well, and I think something that many of us, but exceptionally, or including men, don't think about testosterone is not just testosterone. Testosterone aromatizes into estrogen.
Yes. And
that is very powerful for your brain, for your prostate, for your heart. So if you have no testosterone, you have no estrogen, right? So it's not just that testosterone deficiency, it's the estrogen too. And we don't always, drill that into patients because, again, more of the confirmation bias that estrogen is bad for men when truly it is one of the best things that can be in your body for men and women.
Right. And so for men who take testosterone from most other doctors, they are automatically given an estrogen blocker so they don't make more estrogen. Here, we love estrogen.
Absolutely.
In fact, we give estrogen to men on top of testosterone for the prevention of heart disease, Alzheimer's, and prostate cancer. Prostatitis. There's so many reasons we give estrogen and never block it. And this is going to sound probably strange to a lot of doctors, who've never heard anything about how beneficial hormones are, why there's no reason to block estrogen. It's just a totally different world than conventional medicine.
Yeah, just the idea of not blocking estrogen in men is totally foreign to many, many people.
Exactly.
And you come in many times with the preconceived notion of, oh, well, I have to block the estrogen. But no, you don't. You don't want to. We want to protect your bones. We want to protect your prostate, your brain, your heart, your mood.
Right. Exactly.
Your libido. It's the hidden hormone, I think, for men that we don't often think about. Same with testosterone for women. I think nowadays most people are starting to understand that testosterone is important for women, but I still have patients tell me that their providers would have never offered them testosterone or said, oh, you don't need testosterone.
So it's not FDA approved for women. But here we give, not just us, people give men testosterone and they don't give it to their wives. Guess what? That couple now is separate because one has a good libido, one doesn't. It separates them from each other. We like to treat couples together so they both get the same benefits and they thrive and age together.
Yeah, it's a conversation I have started to have with my patients since being trained by Dr. Ramsey is, hey, this will help your libido. Is this going to match your partner? Because we don't always see the partner immediately. Usually they come around.
Right, exactly.
But it's important to think about those things, the whole picture, the whole person. That's another beautiful part of what we do here is, of course, we do hormones, but we treat the whole body.
Right. Yeah, with hormones being the specialty and the pivotal part.
Absolutely.
Yeah, but I'm glad that you got to meet Angela, those of you who haven't. She's a very hard worker. She brings much to the table. She brings new programs to the office. She's a great team player. And we can tell that she loves what she does and so grateful to have you.
Yes, well, thank you for the kind words. Again, I owe so much of it to you and to our practice and to our wonderful patients for trusting me. And I truly care, and I will continue work every day to deliver the best medicine and wellness.
It shows.
That I can.
Yeah, it shows.
Thank you.
Well, thank you so much for listening. We'll see you next time.